So I'm going to show you the labs of a 37-year-old male that came into me with ulcerative colitis. Now, this gentleman was suffering 12 months before he came into our office. He was having 12 to 15 bowel movements a day. Every single bowel movement, he had blood in his stool. He had to get up 5 to 6 times just in the middle of the night to have a bowel movement. And so, of course, he's been going to the doctor that for the last 12, 15 months while this has been going on. And they've done, medications to try to help with the diarrhea, the constipation, because he went back and forth. The end result, for the last 6 months, he's been on Humira. Look up Humira. It's a tremendous drug as far as what it does negatively to your body and to your immune system, because we understand that ulcerative colitis, it's kind of like IBS, colitis, and autoimmunity all within one condition. And so I said, well, what kind of testing have they done on you? And he said, well, they've done colonoscopies, they've done endoscopies. I've been on multiple rounds of steroids, multiple rounds of antibiotics, and now the end result is Humira. So, well, how's Humira working for you? Well, it has not changed anything. I'm still having 12 to 15 bowel movements. There's blood in every single stool, major cramping, major pain. He won't go anywhere unless there's a bathroom close by. So let me show you the labs, or at least the stool test. I'm just going to show you the stool test. We did other labs on him, but let me just show you what we found in his gut. All right, so this page of the stool test, there's a lot more to the stool test. He definitely had some upper GI issues, his stomach issues, he had some gallbladder dysfunction, but this is just looking at all things as far as the good bacteria, right? So these are the 3 main strains of good bacteria. You can see lactobacillus had absolutely no growth. This is a bacteria that's pretty susceptible to antibiotics and steroids. This is also a super important bacteria to help to produce short-chain fatty acids, what helps to keep that gut nice and sealed. And so without lactobacillus, we know we're dealing with some level of leaky gut. Now, in addition to that, we had 3 different infections. Now, this one, this Klebsiella pneumoniae, a pretty aggressive infection, a bacterial infection in his gut. He also had 2 different strains of yeast. Again, this Candida is a very inflammatory strain of yeast. And so a simple stool test that he performed, we already just from this first page saw that we have 3 different bacterial infections, we have 2 different yeast infections, and we have a lack of the good bacteria. Now, in addition to that, folks, this gentleman also had 2 different parasites. He had a blastocystis parasite and a diatomoeba a parasite as well. Moderate, rare, so, not a ton of these parasites, but they were still present. A moderate amount of these parasites. So someone that's been seeing a gastroenterologist, a GI specialist for over a year, has done numerous colonoscopies, they've done endoscopies, they've done CT scans, they've done all these different testing, and they said, listen, there's really not much else we can do for you. We're going to just put you on Humira, good luck. And so, guys, I get so upset when I see these type of things, because here at The Wellness Way, we don't guess, we test, and we know we have to figure out what exactly is going on in the gut. So this poor gentleman had multiple bacterial infections. He had multiple yeast overgrowths. He had 2 different parasites. And because his GI doc wasn't willing to dive deeper into his physiology, he would sit there, he was suffering, and he was getting sicker and sicker. You have to understand that once your gut gets sick, it is going to affect other systems in your body. It's not a matter of if, it's a matter of when. So with 3 months, we've been working with this guy for 3 months. He's having 3 to 4 bowel movements a day. About 3 weeks into treatment, 3 to 4 weeks, he had no more blood in his stool. He's gaining weight again. His skin issues are clearing up. His energy levels are coming back. He's actually sleeping through the night. So my point of this message here, guys, is you've got to dive deeper into your gut issues. The type of stool testing those doctors are doing, they're ruling out H. pylori, they're ruling out C. diff, major infections, and then colonoscopies and endoscopies, they confirm the presence of inflammation, but they don't tell you why you're so inflamed, right? So if you're dealing with these gut issues, IBS, colitis, diverticulitis, ulcerative colitis, if you're dealing with these issues, reach out to us so we can actually get you answers as to why, and then put you on a path to start moving you in the right direction.